Hello and welcome everyone. I'm Dr. Sachin Kotastane from Lotus Medics. Let's talk about diet and nutrition in pregnancy. As they say, you are what you eat, and so by extension, your baby will be influenced by what you eat as well. Pre-pregnancy nutrition starts months and years before your pregnancy. The goal is to balance the nutrients, both macro and micro, to support the weight of the growing baby, as well as to boost your immune system. Micronutrients and vitamins and minerals like folic acid, calcium, vitamin D, vitamin B and C are very important to maintain fetal growth as well as boost the maternal immune system. For example, in most pregnancies, while a dose of 500 micrograms of folic acid is sufficient, in pregnancies where there's a higher chance of fetal neural tube defect, a higher dose of folic acid, like 5 milligrams per day, is really essential. It is important to monitor your weight in pregnancy, and how much weight gain should you have in pregnancy depends on how much you weigh in the first place. Please check out the Why Your Weight Matters During Pregnancy leaflet from the Ranskog website and other supporting information on the Ranskog and Lotus Medics website on nutrition and weight management in pregnancy. Let's talk about exercise in pregnancy. A reasonable level of fitness will prepare you better, both physically and mentally, for the impending birth of your baby. What are some of the benefits of exercise? Well, it keeps your weight in check, it'll prevent hypertension and diabetes in pregnancy, it'll give you a good sleep and keep your mood in high spirits, and it will also improve your overall fitness. So what sort of exercise should you actually do? Well, regular physical activity that pushes you to the work intensity of a moderate pace, but not so that you're out of breath, is the ideal exercise intensity to be followed. How much should you exercise? Well, that will depend on what your level of fitness is before your pregnancy, and also will depend on if you have any obstetric or medical conditions in your pregnancy that may impede you from doing any further exercise. You should aim for at least 2 to 2.5 hours of moderate intensity exercise per week. If you're not active, start gradually, but again, avoid being a couch potato and avoid prolonged periods of rest as well. Adopt a gradual warm-up and a sustained cool-down, as this will certainly help you with your exercise. Stay hydrated and nourished. Wear breathable, lightweight clothes and exercise in a cool, well-ventilated environment. Strength and conditioning exercises with either light weights or body weight is recommended at least 1 or 2 times a week. Swimming is a really good exercise. It provides both aerobic and strength conditioning and is low impact. But please avoid scuba diving or skiing, as they are classified as high impact exercises. Swimming is a very good exercise that provides both aerobic and strength conditioning benefits. It is also low impact. But please avoid diving, scuba diving, and skiing, as they are classified as high impact exercises. These are some of the things to avoid when exercising in pregnancy. Avoid exercises in high temperatures and humidity. Avoid exercises which place a high load on the pelvic floor. Avoid exercises for prolonged periods of time, especially more than an hour. Don't bump the bump. Avoid all contact sports, as they can be hazardous. Avoid activities with the risk of falling, for example, horse riding, skiing, off-road cycling, and gymnastics. Avoid heavy lifting and exercises that involve straining or holding your breath. Avoid exercises that involve lying on your back after the first trimester. These are some of the signs to stop exercising. If you have a sudden chest pain or calf pain, if you feel unwell, if you have a sudden shortness of breath or dizziness, if you rupture your membranes or have any sudden unexplained bleeding or abdominal pain, or if you're concerned, stop your exercises, go to the nearest doctor, and seek help immediately. Please listen to your body and adapt. Please also refer to our video on exercise and pregnancy on the Lotus Medics website, and also refer to the leaflet on exercise and pregnancy on the Ranscock website. We hope this has been a helpful video for you. Thank you. This is Dr. Sachin Kurustani signing off for today. I hope you've enjoyed our video. If you have any questions or concerns or anything that you would like any consultation on, please do not hesitate to contact us on 1-300-356-887 or email us at admin@lotusmedics.com.au. Thank you.